Question 31. While manually scraping heavy bioburden from the deep lumen of a soiled orthopedic reamer, a technician considers the type of bacteria thriving in this oxygen-depleted environment. Microorganisms that can survive and grow in the complete absence of oxygen are classified as A. Pathogenic bacteria, B. Anaerobic bacteria, C. Aerobic bacteria, D. Vibrio bacteria. Correct answer B. Knowledge point explanation. Core rationale. Anaerobic bacteria are microorganisms that can survive and grow in environments where oxygen is completely absent. In the sterile processing department, these dangerous microbes can often be found deep within narrow lumens or trapped underneath heavy organic bioburden where fresh oxygen cannot penetrate. Trap analysis. Option A is incorrect because pathogenic is a general term for any disease-causing microbe regardless of its oxygen requirements. It would be correct if the question asked for the broad classification of any microorganism capable of causing illness in humans. Option C is incorrect because aerobic bacteria strictly require an oxygen-rich environment for cellular respiration and survival. It would be correct if the question asked for the classification of bacteria that thrive on the exposed flat surfaces of open surgical tables. Option D is incorrect because Vibrio refers to a specific comma-shaped bacteria. It would be correct if the question specifically asked for the morphology of the bacteria responsible for causing cholera. Concept extension. Many serious healthcare-associated infections, such as those caused by Clostridium species including tetanus, are driven by anaerobic bacteria that can form highly resistant dormant spores when stressed. Question 32. While testing the gripping power of a heavy-duty needle holder at the clean assembly workstation, a technician notes the specific plating on the instrument rings. Surgical instruments equipped with durable tungsten carbide jaw inserts are easily identified by A. A diamond serration pattern cut into the jaws, B. Black-plated finger rings and handles, C. Gold-plated finger rings and handles, D. A heavy self-retaining ratchet lock on the shank. Correct answer C. Knowledge point explanation. Core rationale. Tungsten carbide is an extremely hard metal utilized for inserts in the jaws of needle holders and scissors to provide superior gripping power and a longer-lasting edge. The universal medical industry standard is to plate the handles or rings of these specific instruments with gold for rapid visual identification during assembly. Trap analysis. Option A is incorrect because a diamond serration pattern describes the internal physical texture of the jaw, not the external visual identifier on the handle. It would be correct if the technician was using a lighted magnifying lamp to inspect the internal gripping surface of the jaws. Option B is incorrect because black rings are utilized to quickly identify supercut scissors. It would be correct if the technician was searching for a specialized scissor designed with one microserrated blade and one razor-sharp blade for delicate tissue dissection. Option D is incorrect because the self-retaining lock is the mechanical ratchet system that holds any standard hemostatic instrument closed. It would be correct if the question asked for the specific component that must be fully engaged and tested for proper tension during tray assembly. Concept extension. Tungsten carbide inserts can be systematically replaced by specialized repair vendors when they eventually wear smooth, extending the financial life of high-quality surgical instruments significantly. Question 33. While manually brushing the distal tip of a contaminated robotic forceps at the decontamination sink, a technician must carefully avoid getting the proximal control housing excessively wet. Which of the following is a true characteristic of these complex robotic instruments? A. They can be completely disassembled for manual cleaning. B. They feature mechanical and electrical components located in the proximal control housing. C. They are significantly lighter than standard manual laparoscopic instruments. D. They possess an unlimited uses life and never require digital tracking. Correct answer B. Knowledge point explanation. Core rationale. Robotic instruments are highly sophisticated surgical devices that differ significantly from standard manual laparoscopic tools. They continuously feature internal drive cables and complex pulleys housed within the proximal end which physically cannot be disassembled by the sterile processing technician, making them extraordinarily difficult to clean and dry. Trap analysis. Option A is incorrect because robotic instruments are strictly manufactured as single solid units that do not separate into discrete parts. It would be correct if the technician was processing a standard 3-part manual laparoscopic grasper. Option C is incorrect because the heavy proximal housing and internal cables make robotic instruments significantly heavier than manual tools. It would be correct if the question asked to describe the physical weight of a basic standard stainless steel tissue forceps. Option D is incorrect because robotic instruments have a rigidly programmed maximum uses life mandated by the manufacturer. It would be correct if the question asked for the lifespan characteristic of a basic solid stainless steel manual retractor. Concept extension. Due to their internal complexity and strict regulatory tracking requirements, robotic instruments must be processed utilizing uniquely validated automated cleaning cycles and extensive extended drying times. Question 34. While receiving a soiled orthopedic tray at the decontamination window, a technician notes that the scrub nurse thoroughly sprayed the instruments with an enzymatic foam immediately after the procedure. The primary purpose of initiating this point-of-use treatment is to A. Decrease the logistical turnaround times for the scheduling coordinator. B. Prevent chemical pitting and strictly prolong the life of the surgical instrument. C. Reduce the amount of biohazardous waste transported through hospital hallways. D. Ensure all counted instruments are accurately returned to the sterile processing department. Correct answer B. Knowledge point explanation. Core rationale. Blood and physiological saline are highly corrosive to medical-grade stainless steel. If these soils are allowed to dry baked onto the surface, they rapidly cause irreversible chemical pitting and rusting. Point-of-use treatment by applying enzymatic foam keeps instruments moist and actively prevents this catastrophic chemical damage, thereby preserving the hospital asset. Trap analysis. Option A is incorrect because while moist soil is slightly faster to wash off, the primary clinical and financial objective mandated by guidelines is physical asset preservation, not speed. It would be correct if the question asked for a secondary administrative benefit of buying extra backup surgical trays. Option C is incorrect because applying foam does not reduce the physical volume or mass of the biohazardous waste being moved. It would be correct if the question asked for the purpose of completely separating disposable surgical drapes from the reusable instruments in the operating room. Option D is incorrect because spraying foam does not physically count or secure the devices. It would be correct if the question asked for the functional purpose of the surgical post-operative instrument count sheet. Concept extension. Instruments should absolutely never be soaked in normal saline at the point of use, as the high chloride salt content will immediately initiate severe microscopic pitting and destroy the passivation layer. Question 35. While preparing the first bay of a 3-sink manual cleaning station, a technician presses a wall-mounted button to dispense enzymatic cleaner into the measured water. This automatic dosing unit is specifically utilized to A. Deliver a specific and consistent amount of detergent to produce the correct cleaning solution. B. Inject highly pressurized instrument air to actively blow out residual moisture. C. Spray a continuous stream of critical water for the final rinse phase. D. Dispense a concentrated high-level liquid chemical sterilant for immediate soaking. Correct answer A. Knowledge point explanation. Core rationale. To ensure effective biocidal cleaning, chemical detergents must be heavily utilized at the exact concentration specified by the manufacturer instructions for use. Automatic dosing units physically eliminate dangerous human error by precisely measuring and injecting the exact detergent-to-water ratio every single time. Trap analysis. Option B is incorrect because automatic dosing units deal entirely with liquid chemical volume, not compressed air. It would be correct if the technician was using an air gun attachment hooked to a medical gas line to dry a cannulated reamer. Option C is incorrect because dosing units do not dispense pure rinsing water. It would be correct if the technician was opening a dedicated reverse osmosis water faucet located in the third sink. Option D is incorrect because high-level liquid sterilants are never dispensed into open manual washing sinks due to extreme occupational vapor hazards. It would be correct if the question asked for the function of the internal chemical injection reservoir on an automated endoscope reprocessor. Concept extension. Over-concentrated detergent is not only a financial waste but directly leaves a thick chemical film on instruments that fully blocks steam sterilization. Under-concentration will completely fail to dissolve dangerous bioburden. Question 36. After confirming the smooth action of a complex multi-part orthopedic retractor at the assembly table, a technician prepares the device for final steam sterilization. To ensure absolute sterility, this clean multi-part instrument must be A. Left completely assembled to securely protect the internal moving components. B. Lubricated heavily and wrapped tightly in a single layer of woven muslin. C. Completely disassembled according to the strict manufacturer instructions for use. D. Sealed inside a waterproof plastic pouch to prevent steam moisture accumulation. Correct answer C. Knowledge point explanation. Core rationale. For any terminal sterilization process to be successful, the chosen sterilant such as steam or gas must make direct physical contact with all surfaces of the instrument. The mated surfaces of assembled parts completely block the sterilant. Therefore, instruments must be actively disassembled according to the instructions for use to ensure every individual part is fully exposed. Trap analysis. Option A is incorrect because keeping an instrument assembled creates dangerous microscopic dead spaces where microorganisms will survive the sterilization cycle. It would be correct if the question asked how to safely transport the instrument from the operating room to the decontamination area to prevent losing small screws. Option B is incorrect because heavy lubrication blocks steam, and a single layer of muslin is never an approved sterile barrier. It would be correct if the question asked for an outdated and strictly prohibited historical packaging method. Option D is incorrect because steam must penetrate the packaging to sterilize the item, so waterproof pouches would completely block the entire sterilization process. It would be correct if the question asked how to protect a delicate battery pack during facility transport in the rain. Concept extension. Sterile processing technicians must clearly understand the point of contact rule. Any physical area where two hard surfaces touch tightly will absolutely not be sterile unless the specific device has been heavily validated by the manufacturer to be sterilized in an assembled state. Question 37. Before standing at the manual washing sink to vigorously brush a heavy load of blood-soaked orthopedic reamers, a technician dons specialized personal protective equipment. To strictly prevent blood and cleaning chemicals from soaking through to the skin, the technician must wear A. Double-layered woven cloth isolation gown. B. Basic blue surgical scrub suit sets. C. Specialized fluid-resistant or fluid-proof gown. D. Completely sterile operating room surgical gown. Correct answer C. Knowledge point explanation. Core rationale. In the active decontamination area, there is an extraordinarily high risk of being physically splashed with contaminated biological liquids and harsh caustic chemicals. Personal protective equipment gowns must be explicitly manufactured to be fluid-resistant or fluid-proof to prevent biohazardous blood from soaking through and infecting the technician's skin. Trap analysis. Option A is incorrect because woven cloth completely absorbs liquids instantly, offering zero protection against bloodborne pathogens. It would be correct if the technician was wearing extra warmth layers in the clean sterile storage area. Option B is incorrect because scrub suits are highly porous base layers that provide no fluid barrier. It would be correct if the question asked for the mandatory base layer required before entering any restricted clean assembly area. Option D is incorrect because sterile gowns are extremely expensive and used exclusively in the operating room to protect the open patient from staph microbes. Decontamination staff protect themselves from dirty instruments, requiring non-sterile fluid barrier gowns. It would be correct if the question asked for the specific attire required for a scrub nurse actively assisting in an open heart surgery. Concept extension. The Occupational Safety and Health Administration strictly mandates by federal law that healthcare employers provide all appropriate fluid-resistant personal protective equipment at absolutely no cost to the employee to actively prevent occupational exposure. Question 38. While soaking a heavily soiled liposuction cannula in the first decontamination sink, a technician selects a specific enzymatic detergent formulated to dissolve thick adipose tissue. Which specific enzyme acts as a catalyst to actively break down fatty deposits on surgical instruments? A. Active protease enzymes. B. Active lipase enzymes. C. Active amylase enzymes. D. Standard neutral potential hydrogen cleaners. Correct answer B. Knowledge point explanation. Core rationale. Lipase is a highly specific type of biological enzyme that fundamentally acts as a catalyst to aggressively break down lipids, which are fats. Orthopedic and plastic surgery instruments heavily coated in yellow adipose tissue require these dedicated lipase-based detergents for successful cleaning. Trap analysis. Option A is incorrect because protease enzymes are explicitly designed to target and break down protein-based soils such as coagulated blood and torn muscle tissue. It would be the correct answer if the question asked for the absolute best enzyme to rapidly remove dried crusty blood from a vascular hemostat. Option C is incorrect because amylase enzymes target and break down starch in carbohydrate-based soils. It would be correct if the technician was processing dietary equipment or gastric tubes coated in digested carbohydrates. Option D is incorrect because a neutral cleaner is a basic chemical surfactant that contains absolutely zero biological enzymes. It would be correct if the question asked for a gentle general-purpose cleaner explicitly required for anodized aluminum containers or extremely delicate ophthalmic eye instruments. Concept extension. Modern multi-enzymatic detergents purposefully contain a powerful combined cocktail of protease, lipase, and amylase to simultaneously tackle various complex types of mixed organic surgical soil in a single soaking step. Question 39. While visually inspecting the sharp edge of a uterine curette at the assembly workstation, a technician recalls that this specific instrument is designed to scrape the innermost lining of the human uterus. This specific glandular lining is anatomically identified as the A. Vaginal canal, B. Endometrium, C. Fallopian fimbriae, D. Uterine myometrium. Correct answer B. Knowledge point explanation. Core rationale. The endometrium is the highly vascular innermost glandular tissue layer of the uterus. In a dilation and curettage procedure, the surgeon utilizes a sharp or blunt curette to physically scrape away this specific lining for critical diagnostic biopsies or therapeutic clearing. Trap analysis. Option A is incorrect because the vagina is the external muscular tube leading directly up to the cervix, completely separate from the inner lining of the uterus. It would be correct if the question asked for the anatomical birth canal where a specialized speculum is inserted to visualize the cervix. Option C is incorrect because fimbriae are the small, delicate finger-like tissue projections at the extreme distal end of the fallopian tubes that actively sweep the ovum into the tube. It would be correct if the technician was preparing a specialized micro set for a tubal ligation reversal. Option D is incorrect because the myometrium is the thick, powerful middle muscular layer of the uterine wall that forcibly contracts during childbirth. It would be correct if the question asked which anatomical muscle layer is actively cut open during a cesarean section delivery. Concept extension. Long cannulated instruments utilized in gynecological procedures, such as suction curettes, must be rigorously inspected for distal tip integrity and completely brushed internally to ensure they safely sample the endometrium without transmitting cross-infection. Question 40. While updating the standard operating procedures manual at the supervisor desk, a technician strictly aligns the facility cleaning protocols with the latest guidelines published by the Association for the Advancement of Medical Instrumentation. These national healthcare standards primarily serve to outline the A. Minimum acceptable levels of quality and safety for processing medical devices. B. Maximum legal pay scales for certified sterile processing technicians. C. Required daily surgical case volume for maximum hospital profitability. D. Specific commercial brand names of chemical detergents that must be purchased. Correct answer A. Knowledge point explanation. Core rationale. Professional standards and guidelines establish the absolute baseline or the minimum acceptable regulatory requirements that every single sterile processing department must follow nationwide to ensure that surgical instruments are processed effectively and safely for every patient. Trap analysis. Option B is incorrect because national healthcare standards dictate patient safety practices, not employment compensation or salary caps. It would be correct if the question asked for a specific inquiry handled privately by the facility human resources department. Option C is incorrect because surgical volume is a local business metric, fundamentally irrelevant to the clinical science of sterilization standards. It would be correct if the question asked for a specific performance metric aggressively monitored by the Hospital Financial Administration Board. Option D is incorrect because standards describe the required functional chemical actions of detergents, but purposefully never endorse specific commercial brand names. It would be correct if the question asked for a specific purchasing contract aggressively negotiated by the Hospital Materials Management Department. Concept extension. While strict regulations governed by agencies like the Occupational Safety and Health Administration are mandatory by federal law, consensus standards like the Association for the Advancement of Medical Instrumentation are universally considered industry best practices and are heavily utilized by accreditation agencies like the Joint Commission to severely evaluate and grade a facility. Question 41. While inspecting a newly cleaned major orthopedic tray in the assembly area, a technician discovers a small piece of bone still attached to a mallet. When a soiled instrument is found during the assembly process, the A. Instrument should be cleaned with a soft bristled brush and alcohol. B. Instrument should be discarded. C. Entire work area must be cleaned. D. Instrument and the tray it was in should be sent to the decontamination area for recleaning. Correct answer D. Knowledge point explanation. Core rationale. Sterile processing follows a strict one-way flow from dirty to clean. Finding a soiled item in the clean assembly area means the entire tray is now considered contaminated. The only safe and compliant action is to return the entire set to the decontamination area to repeat the full cleaning process. Trap analysis. Option A is incorrect because performing any cleaning in the assembly area is a major infection control violation since it spreads bioburden in a clean environment, and it would be correct if the question asked for a localized spot cleaning method for a non-critical environmental surface like a desk. Option B is incorrect because surgical instruments are reusable assets that must be properly decontaminated, not thrown away, and it would be correct if the question asked about handling a single-use disposable item. Option C is incorrect because finding one dirty instrument inside a tray does not instantly contaminate the entire room, and it would be correct if a biohazard spill occurred directly onto the workstation surface. Concept extension. This event should be documented as a cleaning failure and reported to the decontamination supervisor to identify potential issues with washer disinfector performance or manual cleaning techniques. Question 42. While physically lifting a heavy loaner tray to place it onto a sterilization cart, a technician relies on muscles that are under direct conscious control. Skeletal muscles. A. Move involuntarily. B. Are consciously controlled. C. Pump blood through the circulatory system. D. Line the walls of the digestive tract. Correct answer B. Knowledge point explanation. Core rationale. Skeletal muscles are referred to as voluntary muscles because they are controlled by the somatic nervous system. These muscles are attached to bones and allow for conscious physical activities like walking or lifting heavy instrument trays. Trap analysis. Option A is incorrect because involuntary movement is a characteristic of smooth muscles and cardiac muscles, and it would be the correct answer if the question asked for a defining feature of the muscles regulating internal organs. Option C is incorrect because pumping blood is the specific function of cardiac muscle, and it would be correct if the question asked about the primary role of the heart. Option D is incorrect because the digestive tract is lined with smooth muscle tissue, and it would be correct if the question asked which tissue performs peristalsis. Concept extension. Sterile processing technicians must use their skeletal muscles correctly by applying ergonomic principles such as bending at the knees rather than the waist to prevent workplace injuries. Question 43. While manually brushing a sharp orthopedic reamer in the decontamination sink, a technician sustains a puncture wound and reviews the exposure protocol for the virus that causes hepatitis B. This virus is transmitted by A. Contact, B. Blood, C. Airborne routes, D. Vectors. Correct answer B. Knowledge point explanation. Core rationale. Hepatitis B virus is a primary bloodborne pathogen. It is transmitted through exposure to infected blood or other potentially infectious materials. Sterile processing technicians are at risk during the cleaning of sharp instruments that may carry infected blood. Trap analysis. Option A is incorrect because general contact alone without blood exposure does not transmit this specific virus, and it would be correct if the question asked about the transmission of methicillin-resistant Staphylococcus aureus. Option C is incorrect because hepatitis B is not spread through the air, and it would be correct if the question asked for the transmission route of Mycobacterium tuberculosis. Option D is incorrect because insects or rodents do not spread this virus, and it would be correct if the question asked how Lyme disease or malaria is transmitted. Concept extension. Employers are required by federal regulations to offer the hepatitis B vaccine series at no cost to all employees who have a risk of occupational exposure to blood. Question 44. While a technician is inspecting a sterile tray in the prep and pack area, a vendor arrives to observe the process. Departmental dress codes apply to A. Everyone entering the sterile processing department. B. Only hospital employees. C. Only people spending more than 10 minutes in the work area. D. Only maintenance personnel. Correct answer A. Knowledge point explanation. Core rationale. To maintain the environmental integrity of semi-restricted and restricted areas, anyone who enters, including staff, students, vendors, and executives, must adhere to the facility dress code, which typically includes hospital laundered scrubs and head covers. Trap analysis. Option B is incorrect because bacteria and contaminants are carried by everyone, and limiting the code only to employees would compromise infection control, and it would be correct if the question asked whom a specific hospital employee benefits policy applied to. Option C is incorrect because contamination happens instantly upon entering regardless of time spent, and it would be correct if the question asked about the exposure time required for a specific high-level disinfection soaking process. Option D is incorrect because maintenance workers are just one group of non-staff visitors, and it would be correct if the question asked who is specifically responsible for repairing broken air ventilation systems. Concept extension. The goal of a strict dress code in the sterile processing department is to minimize the introduction of microorganisms and lint from personal clothing into the clean processing environment. Question 45. Before starting the first shift in the decontamination area, a technician physically rotates the spray arms and checks the nozzles of the cleaning equipment. Instrument washer racks and conveyor systems should be inspected. A. Daily. B. Once a week. C. Once a month. D. Only when they malfunction. Correct answer A. Knowledge point explanation. Core rationale. Daily inspection of washer racks ensures that spray arms are spinning freely and that the nozzles are not clogged with debris. This routine physical check is essential to guarantee that every mechanical cycle provides effective cleaning. Trap analysis. Option B is incorrect because weekly checks are too infrequent and allow clogged nozzles to ruin days of processing. And it would be correct if the question asked for the frequency of checking wash station water lines according to some facility policies. Option C is incorrect because waiting a month guarantees cleaning failures will go unnoticed. And it would be correct if the question asked for the standard testing frequency of a steam sterilizer using a biological indicator in some older non-critical settings, though daily is preferred. Option D is incorrect because reactive maintenance can lead to mass production of dirty instruments, and it would be correct if the question asked for the standard timing for calling an emergency repair technician. Concept extension. Documentation of these daily physical inspections is required as part of the Department Quality Assurance Program and will be reviewed during accreditation surveys. Question 46. While placing a dynamic air removal test inside a steam sterilizer chamber, a technician verifies the regulatory status of the testing device. Chemical indicators are classified as A. Class 1 devices, B. Class 2 devices, C. Class 3 devices, D. Unregulated devices. Correct answer B. Knowledge point explanation. Core rationale. The Food and Drug Administration classifies medical devices based on the level of control necessary to assure safety and effectiveness. Chemical indicators are Class 2 devices, meaning they are considered moderate risk and must meet specific performance standards to ensure they accurately reflect sterilization conditions. Trap analysis. Option A is incorrect because Class 1 devices are low-risk items requiring only general controls, and it would be correct if the question asked for the classification of a basic manual surgical instrument like a simple tissue forceps. Option C is incorrect because Class 3 devices are life-sustaining items with the strictest regulations, and it would be correct if the question asked for the classification of infant incubators or heart pacemakers. Option D is incorrect because all devices used in sterile processing that impact patient safety are regulated, and it would be correct if the question asked about generic office supplies like standard copy paper. Concept extension. Any manufacturer wanting to sell a Class 2 device like a chemical indicator must submit a pre-market notification known as a 510(k) clearance to demonstrate the device is safe and effective. Question 47. While diluting a high-level disinfectant solution for manual soaking, a technician verifies the chemical formulation to ensure it can destroy pathogenic microorganisms. The ability to kill or control the growth of living organisms is called A. Biohazard, B. Biofilm, C. Biocompatibility, D. Biocidal. Correct answer D. Knowledge point explanation. Core rationale. The term biocidal comes from bio meaning life and cidal meaning to kill. It refers to any process or chemical agent that is capable of physically killing living organisms, specifically pathogenic microbes during the disinfection process. Trap analysis. Option A is incorrect because a biohazard refers to biological substances that pose a threat to human health, and it would be correct if the question asked what the red warning label on a sharps container signifies. Option B is incorrect because a biofilm is a protective slimy layer created by bacteria to shield themselves from disinfectants, and it would be correct if the question asked for the primary reason why continuous underwater brushing is required. Option C is incorrect because biocompatibility means a material will not harm living tissue, and it would be correct if the question asked about the required property of implantable titanium screws. Concept extension. Disinfectants are categorized by their biocidal activity level, ranging from low level to high level, depending on exactly which types of resistant microbes they can reliably kill. Question 48. After a long shift of pushing heavy sterilization carts, a technician reports persistent wrist and back pain to the department supervisor. Injuries or disorders of the muscles, nerves, tendons, or joints are called A. Musculoskeletal disorders, B. Ergonomic layouts, C. Biological hazards, D. Sharps injuries. Correct answer A. Knowledge point explanation. Core rationale: musculoskeletal disorders affect the body movement system including muscles, tendons, ligaments, nerves, and discs. In the sterile processing department, these physical injuries are often caused by repetitive motions, heavy lifting, or poor posture while working at sinks. Trap analysis: option B is incorrect because ergonomic layouts refer to the scientific design of the workplace to fit the user, not the injury itself. And it would be correct if the question asked for the name of the strategy used to reduce worker strain through better workstation design. Option C is incorrect because biological hazards relate to exposure to infectious blood or bodily fluids, and it would be correct if the question asked about the risk of handling unwashed surgical suction tips. Option D is incorrect because Sharp's injuries specifically refer to puncture wounds from needles or blades, and it would be correct if the question asked about the consequence of reaching blindly into a basin of soiled instruments. Concept extension: to prevent musculoskeletal disorders, technicians must actively use assistive devices like height-adjustable tables and anti-fatigue mats whenever standing for long periods. Question 49. While manually cleaning a rigid sterilization container in the decontamination sink, a technician prepares to wash the filtration components. Rigid container filter retention plates should be A. Removed from the container and lid and cleaned separately. B. Manually cleaned while attached to the lid. C. Wiped down with alcohol without submersion. D. Soaked in a saline solution overnight. Correct answer A. Knowledge point explanation. Core rationale: according to the basic principles of physical decontamination and the manufacturer instructions, all multi-part devices must be fully disassembled. The physical space behind the retention plate can trap bioburden and moisture, therefore, it must be removed to ensure all physical surfaces are completely exposed to the detergent solution. Trap analysis: option B is incorrect because leaving the plate attached creates a shielded area that mechanical brushing cannot reach, leading to hidden debris, and it would be correct if the question was asking for a dangerous shortcut that causes cleaning failures. Option C is incorrect because alcohol is not a cleaning agent and cannot remove protein soils, and it would be correct if the question asked about disinfecting a delicate electronic lens surface that cannot be submerged. Option D is incorrect because saline is highly corrosive to metal components and should never be used in sterile processing, and it would be correct if the question asked what fluid damages surgical-grade stainless steel causing pitting. Concept extension: after cleaning and drying, the technician must physically inspect the retention plates for any distortion or physical damage that could prevent a tight seal with the new filter. Question 50. While performing terminal cleaning of a stainless steel work table in the prep and pack area, a technician uses chemicals to achieve a state completely free of disease-producing microorganisms. This state is called A. Infection prevention. B. Infection control. C. Asepsis. D. Cross-contamination. Correct answer C. Knowledge point explanation. Core rationale: asepsis is defined as the physical state of being completely free from pathogenic or disease-producing microorganisms. In the healthcare setting, technicians use strict aseptic techniques when handling sterilized goods to maintain this physical state and prevent the transfer of dangerous germs to vulnerable patients. Trap analysis: option A is incorrect because infection prevention refers to the broad educational programs used to stop infections, and it would be correct if the question asked about the role of the hospital epidemiologist teaching hand washing. Option B is incorrect because infection control refers to the active policies and physical procedures used to minimize disease spread, not the end state of being germ-free, and it would be correct if the question asked for the name of the hospital department tracking outbreak data. Option D is incorrect because cross-contamination is the actual transfer of bacteria from one surface to another, and it would be correct if the question asked what happens when a worker touches a sterile tray with unwashed bare hands. Concept extension: there are two core types, which are medical asepsis used to physically reduce the number of microbes and surgical asepsis used to absolutely eliminate all microbes from an item. Question 51. While physically wiping down a stainless steel decontamination sink with a chemical wipe, a technician monitors the clock to ensure the liquid remains on the surface for the required duration. The amount of time an item must remain wet with a disinfectant to achieve destruction of microbes is called A. Holding time. B. Wet contact time. C. Activation time. D. Sterilization time. Correct answer B. Knowledge point explanation. Core rationale. Wet contact time is the specific duration that a chemical disinfectant must remain in a liquid state on a physical surface to effectively kill the microorganisms listed on its label. If the surface dries before this time elapses, the disinfection process is incomplete and invalid. Trap analysis. Option A is incorrect because holding time refers to the duration an item is kept in a specific state before processing, and it would be correct if the question asked for the maximum period instruments can be kept moist under a pre-cleaning transport spray. Option C is incorrect because activation time refers to the mixing process of chemical solutions, and it would be correct if the question asked how long a technician must wait after mixing a bottle of high-level disinfectant before using it. Option D is incorrect because sterilization time refers to the critical exposure phase within a pressurized chamber, and it would be correct if the question asked for the plateau phase of a steam cycle. Concept extension. Different chemicals have varying wet contact times, ranging from 30 seconds to 10 minutes. Therefore, technicians must always read the physical manufacturer label to ensure strict compliance. Question 52. While visually inspecting a newly assembled set of orthopedic retractors under the bright lights of the prep and pack station, a technician evaluates the highly reflective surface. When a surgical instrument has a shiny, highly polished surface, it is said to have A. Satin finish. B. Passivation layer. C. Matte finish. D. Mirror finish. Correct answer D. Knowledge point explanation. Core rationale. A mirror finish is a highly polished reflective surface on surgical instruments. While it is extremely resistant to physical corrosion and staining due to its smoothness, it can cause significant visual glare for surgeons under the intense lights of the operating room. Trap analysis. Option A is incorrect because a satin finish is a duller surface preferred for reducing glare, and it would be correct if the question asked for the specific finish type that helps prevent surgeon eye fatigue during long procedures. Option B is incorrect because a passivation layer is an invisible chemical chromium oxide shield, not a visual finish, and it would be correct if the question asked what nitric acid creates on stainless steel to prevent rust. Option C is incorrect because a matte finish is intentionally non-reflective and textured, and it would be correct if the question described an instrument chemically etched to eliminate all shine completely. Concept extension. Regardless of the visual finish type, all surgical-grade stainless steel instruments must undergo the passivation process during manufacturing to build a protective anti-corrosion barrier. Question 53. While physically assembling a complex orthopedic spine set, a technician reviews the pick list requesting specific rongeurs designed for a laminectomy procedure. The word laminectomy means A. Surgical removal of a cyst in the spine. B. Surgical removal of part of the vertebrae. C. Surgical insertion of titanium rods into the spine. D. Visual examination of the spinal canal. Correct answer B. Knowledge point explanation. Core rationale. A laminectomy is a physical surgical procedure where the surgeon removes the lamina, which is the back part of a vertebra that covers the spinal canal. The root word lamin refers to the lamina, and the suffix ectomy means surgical removal. Trap analysis. Option A is incorrect because removing a cyst is medically termed a cystectomy, and it would be correct if the question asked for the procedural term describing the excision of a fluid-filled sac. Option C is incorrect because physically inserting metal rods is a spinal fusion or internal fixation, and it would be correct if the question asked for the definition of spinal stabilization with instrumentation. Option D is incorrect because visual examination uses a lighted scope, and it would be correct if the question asked for the definition of a spinal endoscopy. Concept extension. Technicians must ensure that kerosene rongeurs used in a laminectomy are perfectly clean because sharp bone fragments often get physically wedged deep in the sliding mechanisms. Question 54. While physically consulting a manufacturer instruction manual to properly disassemble a complex robotic surgical arm, a technician verifies the federal agency that regulates these documents. The organization that issues regulations to ensure medical devices are safe is the A. Food and Drug Administration. B. Environmental Protection Agency. C. Department of Transportation. D. Occupational Safety and Health Administration. Correct answer A. Knowledge point explanation. Core rationale. The Food and Drug Administration is the federal agency responsible for protecting public health by physically ensuring the safety, efficacy, and security of medical devices. They legally require manufacturers to provide validated instructions for use for every medical device sold. Trap analysis. Option B is incorrect because this agency strictly focuses on environmental impact, and it would be correct if the question asked who regulates the registration of antimicrobial chemical pesticides or ethylene oxide emissions. Option C is incorrect because this agency manages the physical movement of goods, and it would be correct if the question asked who strictly regulates the transportation of biohazardous materials on public highways. Option D is incorrect because this agency exclusively protects worker safety, and it would be correct if the question asked who mandates the use of heavy personal protective equipment in the decontamination area. Concept extension. Following the validated manufacturer instructions is not optional, but rather a strict federal regulatory requirement for all physical sterile processing activities. Question 55. While physically changing into clean facility laundered scrubs, a technician secures their personal mobile phone in a locker to prevent bringing it into the preparation assembly area. Personal electronics must not be taken into clean work areas because they A. Can become physically damaged by steam sterilizers. B. Cause bright glare under the inspection table lights. C. Can harbor and transfer dangerous microorganisms. D. Emit radio frequencies that disrupt biological incubators. Correct answer C. Knowledge point explanation. Core rationale. Personal electronics like mobile phones are scientifically known to be significant physical reservoirs for bacteria and other pathogens. Bringing them into a clean processing environment introduces a massive physical risk of cross-contamination to the surgical instruments being assembled. Trap analysis. Option A is incorrect because while physical damage is possible, the clinical regulatory priority is patient safety, not electronic device protection, and it would be correct if the question asked why delicate fiber optic light cables must not be placed under heavy metal retractors. Option B is incorrect because phone screens do not cause enough visual glare to disrupt physical inspection, and it would be correct if the question asked why a mirror finish on surgical instruments is sometimes problematic for surgeons. Option D is incorrect because modern phones do not disrupt basic heat incubators, and it would be correct if the question asked why certain magnetic devices are banned near a magnetic resonance imaging machine. Concept extension. If a technician must carry a facility-approved communication device for emergency contact, it must be physically wiped with a germicidal disinfectant according to strict hospital infection control policy. Question 56. After a major surgical procedure finishes, a technician physically pushes a sealed transport cart to collect the soiled instruments. Contaminated items should be returned to the decontamination area. A. Inside open wire baskets to allow for air circulation. B. By hand carrying them through the public hospital hallways. C. Inside enclosed rigid containers or sealed leak-proof carts. D. Only after soaking them in a concentrated bleach solution. Correct answer C. Knowledge point explanation. Core rationale. In any healthcare facility, there are strict safe pathways for contaminated items to physically return to the decontamination area. All transportation methods must utilize enclosed physical containment, such as sealed carts, to prevent dangerous biohazardous fluids from dripping or aerosolizing into the public environment. Trap analysis. Option A is incorrect because open wire baskets allow biological hazards to freely drip or aerosolize into the environment, and it would be correct if the question asked how clean, sterilized wrapped goods should be stored on sterile storage shelving. Option B is incorrect because hand-carrying exposed contaminated instruments physically violates all federal transport safety regulations, and it would be correct if the question asked for an example of a severe infection control violation leading to immediate disciplinary action. Option D is incorrect because bleach is highly corrosive to surgical-grade stainless steel, and it would be correct if the question asked what household chemical damages needle holders causing severe pitting and irreversible rust. Concept extension. Regardless of the secure delivery method, the biohazard warning label must be clearly visible on the physical transport container to alert staff and the public of the potential bloodborne risk. Question 57. While physically inspecting a powered orthopedic drill in the assembly area, a technician discovers a frayed electrical cord and initiates a mandatory device failure report. Device-related problems are reported to the federal government through A. The Joint Commission, B. The General Duty Clause, C. The MedWatch Program, D. The Centers for Disease Control and Prevention. Correct answer C. Knowledge point explanation. Core Rationale. MedWatch is the official safety information and adverse event reporting program maintained by the Food and Drug Administration. It specifically allows healthcare professionals to report serious physical problems or malfunctions they suspect are associated with the medical devices they process or use. Trap analysis. Option A is incorrect because this is a private accrediting body that evaluates overall hospital performance, not a federal device safety database, and it would be correct if the question asked which agency performs unannounced physical site surveys to verify facility compliance. Option B is incorrect because this is a specific occupational safety regulation protecting workers from recognized workplace hazards, and it would be correct if the question asked what mandate requires employers to provide a safe physical workplace free from serious harm. Option D is incorrect because this agency strictly focuses on epidemiology and broad disease outbreaks, and it would be correct if the question asked who publishes the definitive guidelines on hand hygiene in healthcare settings. Concept extension. Prompt reporting via the MedWatch system is essential for the federal government to identify mechanical trends and issue nationwide recalls to prevent further patient injuries. Question 58. While loading soiled heavy orthopedic trays onto a transport vehicle, a technician ensures the doors are completely sealed before moving toward the elevator. Items must be securely contained during transport to A. Protect the metal instruments from physical scratching during movement. B. Keep specific doctor preference instrument sets perfectly organized. C. Prevent the spread of biohazardous microorganisms into public areas. D. Hide the bloody instruments from the view of sensitive hospital visitors. Correct answer C. Knowledge point explanation. Core Rationale. The absolute primary clinical objective of physical containment during transport is strict infection control. Using closed carts or sealed leak-proof containers actively prevents biohazardous materials from splashing, spilling, or aerosolizing into the public hallways and elevators of the hospital environment. Trap analysis. Option A is incorrect because while damage prevention is good, the strict regulatory mandate for physical containment is infection control, and it would be correct if the question asked for the purpose of using silicone finger mats inside a delicate eye tray. Option B is incorrect because organization is a physical efficiency goal, not a safety transport requirement, and it would be correct if the question asked for the primary benefit of using customized computerized surgical pick lists. Option D is incorrect because while aesthetics matter, the strict legal requirement is based on preventing physical biohazard contamination, and it would be correct if the question asked for a secondary non-regulatory psychological benefit of using opaque transport bags. Concept extension. Containment protocols also dictate ensuring that sharp physical instruments are positioned safely so they cannot puncture the transport bag or injure the decontamination staff receiving them. Question 59. While physically setting up the 3-bay manual cleaning sink, A technician inspects the nylon scrubbing tools for wear and tear. Reusable decontamination cleaning brushes must A. Be cleaned and thermally or chemically disinfected at least daily. B. Feature stiff stainless steel bristles to scrape off heavy dried bone. C. Be significantly larger than the internal diameter of the surgical lumen. D. Be stored continuously soaking in a basin of enzymatic detergent. Correct answer A. Knowledge point explanation. Core rationale. Because physical cleaning brushes are repeatedly used to remove heavy bioburden, they themselves become highly contaminated with dangerous pathogens. They must be rigorously cleaned and subjected to high-level disinfection or sterilization at least daily to ensure they do not recontaminate instruments. Trap analysis. Option B is incorrect because rigid metal bristles will heavily scratch the protective passivation layer of standard instruments, leading to rapid corrosion. And it would be correct if the question asked for the specific brush type used exclusively on the tungsten carbide inserts of a needle holder. Option C is incorrect because a massively oversized brush will physically fold flat inside the tube, preventing the bristle tips from creating friction against the walls. And it would be correct if the question asked what user error causes a brush to become permanently wedged inside a suction tube. Option D is incorrect because continuously soaking brushes promotes massive bacterial growth in the stagnant fluid, and it would be correct if the question asked for a dangerous physical practice that creates a biofilm hazard at the sink. Concept extension. Brushes must be physically inspected daily for frayed bristles or damage because a worn-out brush will not effectively reach the microscopic surfaces of a physical lumen and must be discarded. Question 60. While physically assembling a specialized cardiovascular surgery tray, a technician reads the procedure card indicating the patient has a condition involving hypothermia. The medical prefix hypo means A. Moving rapidly during a procedure. B. Above normal or excessive. C. Below normal or deficient. D. Measured precisely with electronic sensors. Correct answer C. Knowledge point explanation. Core rationale. The prefix hypo is derived from Greek, meaning under, below, or less than normal. In medical terminology, it consistently indicates a physical deficiency or a lower than expected clinical level, such as hypodermic meaning strictly below the skin. Trap analysis. Option A is incorrect because the medical prefix for abnormally fast is tachy, and it would be correct if the question asked for the prefix meaning in the cardiovascular word tachycardia. Option B is incorrect because the prefix for above or excessive is hyper, and it would be correct if the question asked for the prefix meaning in the blood pressure term hypertension. Option D is incorrect because there is no single prefix for precise physical measurement, and it would be correct if the question asked for the specific clinical function of an electronic biological indicator reader. Concept extension. Thoroughly understanding physical prefixes like hypo meaning low and hyper meaning high allows technicians to precisely interpret surgical instructions and anatomical conditions when preparing specialized procedure sets.